Good afternoon. Welcome to this daily update briefing on coronavirus COVID-19 situation in the country. Ladies and gentlemen, today we have recorded the highest number of positives cases since we started testing and since our first case. We have today 184 cases that have returned a positive result after testing a sample size of 2,518 over the last 24 hours. You will agree that we are beginning to see a rise in the number of positives as we move along. Just as we had said earlier, all indications are that we are now probably entering into the exponential phase of our curve, which is the steep rise phase of our curve. And going forward, we are likely to see more larger numbers of positives being returned every day. This is serious and a situation that we all need to be concerned about. The numbers are rising because the transmission within the community is also rising. Such figures have the potential to quickly overwhelm our health facilities. We must not allow this situation to happen. I'm therefore appealing again to all Kenyans that in order to try to manage these numbers, to keep down these numbers as we move along, as far as possible, flattening the curve and pushing it to the right as far as possible allows us to be able to deal with those cases that come up that need clinical management, given our capacities of our health systems. We need to manage that, and the way to manage that is through the containment measures that have been put in place. I appeal to my fellow Kenyans that we must more than ever now strictly adhere to the containment measures that have been put in place. That is the strict observance of hand washing and hygiene, social and physical distancing, wearing masks, avoiding gatherings. All of these measures will be able to allow us to push this curve so that we can be able to deal with those that turn out positive and those that need clinical management. The positive cases now push our cumulative numbers to 4,044 out of a total of 124,474 samples that have been tested in the country so far. In terms of gender, 129 of the cases today are males, while 55 are females. And all of them except one are Kenyans. The 184 positive cases are distributed in counties as follows. Nairobi has 111 cases, Mombasa 19, Kajiado 14, Meru 13, Kiambu 9, Busia 6, Nakuru 4, Machakos 3, Kwale, Kisumu, Garissa, Taita Taveta, and Vihiga counties, 1 case each. The last county, Vihiga, now becomes the latest county to record a COVID-19 case, bringing the total number of counties so far affected to 40. By sub-counties, the cases are distributed as follows. In Nairobi, there were 33 cases in Westland, 19 in Kibra, 18 in Langata, 15 in Embakasi East, 12 in Dagoretti North, 4 in Kamkunji, 2 in Makadara, 2 in Starehe, 2 in Embakasi Central, Roysambu, Embakasi West, Kasarani, and Embakasi South had 1 case each. In Mombasa, the cases are from Mvita, 9, Changamwe 4, Likoni 2, Nyali 2, Jomvu and Kisauni 1 case each. In Kajiado, we have 12 cases from Kajiado Central, Kajiado East and Kajiado North 1 case each. In Meru, the 13 cases are all from Imenti North. And in Kiambu, the 9 cases are from Lari 3, Juja 2, Kabete, Kikuyu, Kiambu Town, and Limuru 1 each. In Busia, all 6 cases are of truck drivers in Malaba and Matayos. 5 in Malaba and 1 in Matayos. In Nakuru, the 4 cases are from Naivasha, 3, Nakuru East, 1. In Machakos, all 3 cases are from Athi River, while in Kwale, the 1 case is from Lunga Lunga. In Kisumu, the 1 case is from Kisumu Central. In Garissa, the 1 case is from Garissa Township. And in Taita Taveta, 1 case is of a truck driver. In Vihiga, the case is from Vihiga Town. On a positive note, we are glad to report that today we have discharged 27 patients from our various facilities, bringing the total tally of recoveries to 1,353. Sadly too, we have lost 2 more patients to the disease. The total number of fatalities now stands at 107. And again, we express our deepest and heartfelt condolences to the families and friends of the bereaved during this trying moment. Fellow Kenyans, as we have observed, our numbers of positive cases are steadily rising. And it is a matter that we all need to be concerned about. This further confirms that community transmission is now quite well established within the country. As we try to trace and treat, testing becomes a cardinal feature of the strategy of our response. Testing and accuracy of testing will become increasingly important as these numbers continue to rise. And I want to take this opportunity to talk about observations in this area that are concerning us. We have noticed, for instance, that several testing kits that purport to diagnose COVID-19 have permeated our market. I think this is a matter that needs to be addressed, and I want to say a few words about this. First and foremost, the standard test that the ministry uses as a diagnosis of COVID-19 is the real-time PCR test based on detection of nucleic acid of the virus. That is the only test that definitively identifies the presence of coronavirus in those that turn out positive. We have talked about this issue before. That's the valid test for diagnosis of COVID-19. Yes, there are other tests that have been developed since then that are not based on detection of the nucleic acid, but are based on detection of either antibodies that a person may have raised as an immune response to exposure to the virus. These are the so-called antibody-based rapid diagnostic tests, or RDTs. And it is these RDTs that concern us, because these RDTs that have permeated the market and are being vended out there and are being presented as a test for diagnosis of COVID-19 is incorrect. As far as the position of the ministry is concerned right now, the only test that can diagnose and state that an individual is positive for COVID-19 is the real-time PCR test. The ministry has approved, in addition to its own laboratories within the ministry, the National Public Health Laboratory, within the Kenya Medical Research Institute, and other partners, and a few partners in the private sector that include the big hospitals such as Nairobi Hospital, Aga Khan Hospital, and a few other private labs. So there's a select number of approved facilities by the ministry that offer this real-time PCR-based test. The RDT test is still under consideration. Even WHO has not provided any guidance yet on the RDT tests because, one, they are not sufficiently sensitive and specific to detect what they have been developed for. And number two, their use in diagnosis of COVID-19 is still uncertain. These RDT tests, however, do tell something when they work. And what they tell you, the test when it turns out positive, what they tell us is that that individual was exposed to COVID-19 and therefore mounted an immune response, resulting in antibodies within the person's circulation, and that is what is picked by the test. It does not tell you if the virus is present and active within that individual. So these tests cannot be used for diagnosis for now, until further information is received in terms of exactly how they perform and what it is they detect. And that's the reason why we say any of those tests are not a test for COVID-19 disease. And I want to tell Kenyans also who are being told that they will be tested for COVID-19 using these 15-minute, very quick assays, rapid tests where a puncture is made on your fingertip, a drop of blood is drawn out, put on a cassette, what they call the lateral flow systems, and then you see a band. I think all of you are familiar with the test for malaria. Each one of us must have gone through that one time or other. This test for COVID, which works in that fashion, is not the right test. That is not to say that these tests do not have value in terms of telling us something. Indeed, for now, they do have value because they can tell us the level of exposure within a community or within a population. And therefore, they have been authorized for use for purposes of surveillance and research. And in fact, as a ministry, we plan to use some of these tests just to do surveillance so that we get an idea of the level of exposure of coronavirus in our communities. So what I want to state here is that for Kenyans, please do not take those results as of an RDT test for now, giving you the comfort that either you are negative of COVID-19, or in some cases giving you the anguish of telling you that you are COVID positive. The only test that is accepted and the gold standard for COVID-19 right now is the real-time PCR test. Secondly, for those who are vending these tests, we also want to caution them not to misrepresent the utility of these RDTs in diagnosis of COVID-19 disease. Equally, to our own regulatory authorities, we will in the coming days be streamlining the processes of having these tests on the market and determining exactly for what purposes they can be used. I also want to add on to this discussion today the issue of quality and accuracy of testing. With many labs providing a test such as the RT-PCR, we have heard of cases where tests in one lab turn out one way, when taken to another lab, they turn out another way. These, we believe, are issues to do with quality or handling of the material, the virus transport media, the processes involved in extracting the nucleic acid, and the quality issues around the samples and the testing procedures. As a ministry, we have put in place a QA system, quality assurance system, that will be able to ensure that all these labs can be monitored in terms of their quality of tests that they are providing, because the quality assurance systems will be able to determine how good a lab is in returning the correct result. And these quality assurance protocols will be put in place in the very near future so as to remove that ambiguity of test results. Where labs that are approved fail to consistently meet a certain quality level, then appropriate action will be taken as well in ensuring that they take corrective measures to be able to provide the right results, or any other action that may be deemed necessary at that time. I would like to stop at that, and I want to thank you, but we shall take some questions. I have my colleagues here who will be able to respond to some of those technical questions that you may